Hi everyone, my name is Claire and I have recently completed a PhD at the University of Leeds where I had two great supervisors, Dr. Dani Barrington, who will be available for questions after this presentation here today, and Professor Barbara Evans. I'm here today to talk to you about my findings from the first phase of my PhD, being Child SAN, a new disability inclusive framework for emergency sanitation for children aged 5 to 11. I'm going to outline what we meant by emergency sanitation for children, why providing emergency sanitation for 5 to 11-year-olds is important, what the Child SAN framework is, and how it can be used in practice. So first of all, what do we mean when we're talking about emergency sanitation for children? First, in emergency, we use the UNICEF definition, being a situation that threatens the lives and well-being of large numbers of a population and requires extraordinary action to ensure their survival, care and protection. We used a broad definition of sanitation, being the ability to effectively access space and facilities whenever and wherever needed that afford privacy, dignity and safety in which to urinate, defecate and practice related hygiene, including menstrual health management, in a culturally acceptable manner. And finally, the definition of a child. Cultural definitions of the upper limit of childhood may vary, but the United Nations defines a child as every human being below the age of 18 years unless country laws say otherwise. When we put these three concepts together, things can get complicated. This is primarily because children are particularly vulnerable in an emergency. Within the disruption, children of any age and ability face a range of heightened risks, particularly if separated from family or caregivers. These include disease, gender-based violence, malnutrition and trafficking. And whilst children are usually dependent on others to provide their needs, in an emergency, a child may be dependent on people that are not their usual caregivers. And we know that providing sanitation in an emergency is also complicated, as WASH programs aim to move beyond providing rapid relief in the initial phases of an emergency response to ensuring conditions that allow people to live with good health, dignity, comfort and safety. When I started my PhD, I wanted to know about emergency sanitation currently being provided for children aged 5 to 11, those too old to use small potties, but usually too young to safely and confidently use adult latrines during both the day and night. This age group has often been overlooked in the provision of emergency sanitation, but there are multiple reasons to provide sanitation specifically for 5 to 11-year-olds. First of all, they represent a large number of beneficiaries. In 2021, 15% of known persons of concern were aged between 5 and 11 years of age. That's almost 9 million children. Legal principles and the moral obligations of humanitarian actors should also drive their inclusion in sanitation programs. There is a human right to sanitation, and to achieve this human right, the international community is striving to attain Sustainable Development Goal 6.2 to achieve access to adequate and equitable sanitation and hygiene for all. And the humanitarian imperative is to take action to prevent or alleviate human suffering arising out of disaster or conflict. Failure to consider the specific needs of this age group can result in them not wanting to use or not being able to use the sanitation facilities available. They may urinate or defecate elsewhere, which puts them at an increased risk of injuries, abuse, exploitation, and there can be negative health impacts due to not being able to manage their personal hygiene. Because there wasn't much consideration for this age group, we critically reviewed the existing guidance for the provision of emergency sanitation for children aged 5 to 11 and developed a new framework that the WASH sector can use to better provide sanitation facilities for children, and we called it Child SAN. Child SAN is an acronym representing key factors for the WASH sector to consider in emergency sanitation programs. For example, C represents child participation in the design of sanitation facilities. We've written a paper on Child SAN, which was published in the Journal of International Humanitarian Action, and it's an open access paper. It provides all of the detail for each aspect of the framework, which I won't replicate here. Instead, we've provided D for decor as an example of what you can expect to find. To support the implementation of the Child SAN framework, we have also published a 2-page guidance note and an observation checklist to help implement guidance in the field. The observation checklist was trialled in Bangladesh and Uganda, and feedback from its use there has been incorporated into the latest version. The paper, guidance note and observation checklist can all be found online on the Open Science Framework at the link provided on the slide. I I believe that the implementation of Child San would contribute to the wash sector's aims of achieving universal sanitation and maximising opportunities for good health, dignity, comfort and safety for all. So I encourage you to have a look at the guidance, maybe try using the checklist, and please do let me know if you have any feedback. Thank you for listening.